I think I'll wait. Telling followers turn off my ringer right there. Hello, welcome. I'm just going to wait a few minutes while everybody kind of gets the alert that we're live here. Thanks for hopping on. Maybe I'll just kind of start at 3 minutes after. I'm going to try... Hi. No questions. Can send and see questions here. Perfect. I'm just going to get started at maybe 3 minutes after the hour. Hi. Welcome. I just figured I'd wait a couple of minutes for everybody to kind of... North Shore Dent. Hey, Leslie, how are you? Just going to give it a couple of minutes. Hey, Sally. I'll kick things off at about... I'm good. Thanks. How are you? Nice. So I guess what I'll do before I get into kind of the official... the Ask Me Anything part, because we had a great response and some pre-submitted questions and things like that I want to address. I'm going to do my best. So I'm not on social media personally myself very much, so I'm not an expert at Instagram per se, but I'll try to see and notice if you're asking questions in the chat, which I think there is like a question bubble. So try to ask them in there. I'll pause, I'll look at questions, because I do want this to be kind of loose and interactive, and I want it to feel like a conversation. So I'm here for that, and really just to answer any questions, talk about TempStars a bit, where we're going, where we've been, and those sorts of things. So we'll make it as kind of informal as possible. So maybe just to start, so I will touch on that. So we just launched a complete revamp of our entire membership management system. So I am going to touch on that, which is sort of one of the reasons to do the Ask Me Anything, because we've had this membership management system in place for the last 8 years, and it has worked okay. But at the same time, I built it very early on, relatively straightforward algorithm and statistical analysis and things like that. So it's always been based on real trends of our real members and things like that. But as we started to get larger and scaled, it just was not addressing the nuance of things happening and that sort of thing. And so it was sort of like we were realizing this system was broken. And not only was it broken, we were asking our membership management team and our customer support to manage sort of a broken system with the best tools they had available. So the new membership management is called Fair Fresh Start. I did a fairly comprehensive webinar on it in anticipation of releasing it, which is maybe 3 or 4 weeks. It might be a month ago now. So the newsletter that's going out, I think it's going out today or tomorrow, there should be a link in there about Fair Fresh Start in the webinar that explains everything. So I really think that will address most of the things related to accounts, because it's a lot more nuanced and it takes into more pathways for success, sidelining less people if they're trending in certain directions, and just letting people know, you might be trending in this direction, here's a course to take, or here's some resources to help you succeed and things like that. Because we really don't like it if we need to, say, block somebody or that sort of thing, because that limits dental offices' access to great dental professionals, and it also can kind of inhibit a person's ability to support themselves and their families on our platform. So we really don't like doing that, but admittedly, our previous system was a little bit broken, so we've completely revamped it. We have another update that improved it even further that went out a couple of days ago, and then we have another release coming out that should be next week that has a few other little tweaks and fixes. So as that rolls out, it should catch most things, but if you have a situation with your account even with this new membership management system, there should be rare, if any, situations where you are permanently sidelined, but opportunities and resources and paths for success. Yeah, Sally, I can understand. We really do care, and we're introducing an entire membership management system for dental offices too, and we just had a meeting about that yesterday, about how do we provide that transparency and clarity about which offices are providing great experiences for people on TempStars and which ones are causing challenges and that sort of thing, and at the same time set the offices up for success to let them know about trends that they might be running into and offer them resources to be successful and turn a corner and that sort of thing. So we really do. Our whole team, all we think about and all we care about is we listen, we talk to customer support, they're kind of our eyes and ears, we figure out what's been going on, how do we improve our matches and our system and make sure things are fair. So yeah, if it was more than 3 years ago, that would have clearly been under the broken system, and so definitely an opportunity for a review there. So before we get too far in, I'm just going to give you a little bit of a background, because if you're new to TempStars or don't really know the backstory sort of thing, I'll just tell you briefly. So I'm a practicing dentist of 27 years now. I still practice out of a mental health hospital with my lovely assistant Pam and Sarah and Tamara, part-time. I've owned 2 practices. I've done full mouth reconstruction, sinus lifts, bone grafts, all of that kind of stuff, soft tissue surgery, and those sorts of things. But back in 2015, came up with this idea for TempStars because I was having a challenge in my office about finding somebody last minute as a hygienist. So back in 2015 was the idea. 2017, we launched with only hygienist and only temping, and it was really only in the very core GTA Toronto area, and then just sort of grew and expanded from there, added dental assisting and then a job board, and we just recently added admin temping for dental assistants as well and things like that. So in the very early days, it was really just me. So I was all of those emails that you might get as confirmations, that was just me handwriting those. I was hand typing them and sending them out from my own email. I was driving on the highway, and every 2 hours I would just stop and pull over on the side of the highway and tether my phone to my laptop to see if there was any problems or if there was new connections and matches and things like that. So it's really grown out of a real passion for caring about providing, great matches and just helping everybody be happy in dentistry, because it's a challenging work environment sometimes. And one of those challenges can be finding what feels like your work home, or if you're a dentist or an office manager or a dental practice owner, finding a great team that you feel that can support your patients and your growth. So that's been the entire fundamental kind of core focus of what we've been thinking about. And so as our team talks and we meet and discuss things, that's what we think about, and we have a set of values that we follow, and we go through our values at each meeting, and we take turns reading them and how we might reflect on them and things like that. So if you've ever met anybody on our team, you won't meet a cynical person or anybody who cares about anything other than just helping and support our members. And I'm very lucky to have surrounded myself with people who kind of are aligned with that and share my values that way. So that being said, I'm just going to read these questions, and I will try to answer as I see the questions come up. Probably what I'll suggest is if it's a specific question about an account, I might touch on it a bit, but for the sake of everybody's interest, I'm happy to answer specific questions like that, but I might just say, let's make a note of this, contact support tomorrow, and we'll make sure that it's dug into with the proper thoroughness. I'm going to talk about the TempStars account. Thanks. So again, maybe just check with support, and we'll be in touch with them about that, and we'll figure out what we can do to help you with that. So I'm just going to just read through a couple of questions here, and I'll try to answer them as we go. So we had one question that just said, can I pick a shift because it's not working for me in the app? Now, that is from Suiba, and I don't know. I mean, I think that one I'll just send off to our product team and our support team to see if there might be a glitch that would be preventing you from seeing shifts. It depends where you are, because I don't see a location in the question. So if you're in an area where we don't necessarily have a lot of postings, like if you're in a remote area or somewhere where we just don't have that same network effect and the same strength of connections, that could be a reason. But you should be able to see shifts in the app if you're in an area where we are. And you're a dental assistant. Yeah, so I'm going to make a note of all of these too, and we'll review them tomorrow as a team and make sure that anything that I can't directly address here, that we get sorted out as either a team to look into to see if there's a glitch that we need fixing, or if there is an issue with your account that we need to kind of dig into. Next one, I'm a dental assistant dental hygiene student, third semester, I have HARP, and I have a 2-year Canadian dental assistant and 6-year back home as dentist experience. Still, I am not able to log into the app. So if you're a dental hygiene student and HARP certified and as a dental assistant, you should be able to pick up, and there are a fair number of internationally trained dentists who use TempStars either for hygiene or for dental assisting. And we just did a seminar for internationally trained dentists to help set them up for success and that sort of thing. So as a dental assistant who is HARP certified, you should be able to view and send in offers for shifts as a dental assistant. And then once you have your hygiene degree, then of course we can upgrade you to the hygiene account to look at hygiene shifts. That could be a technical glitch, but without knowing too many more details, again, I'll make a note of that one and just make sure that we dig into that to find out if there's something going on with your account. There's Sinate. Again, just a question about your account. And I will say, the new system we just rolled out, we rolled it out on July 2nd, and then there was a few little tweaks and fixes we needed to do that we sent out another release a couple of days ago. And there's one more to do, a last minute polish up on it too. So any little kind of lasting effects where somebody, because there was little edge cases, right? We do a lot of thorough testing, and Holly is incredibly diligent at making sure that the app goes out as expected without glitches. But we can only test so many cases and so many accounts and so many things in our sort of test sandbox, and we say, this is working great, let's get it out. But if you can imagine, at this point, I think we've completed, I don't know, maybe 1.3 million hours of temping shifts, and we do thousands and thousands of temping shifts. I think the last check, we had helped dental hygienists and assistants earn over $65 million in dental temping earnings. So when you test in a sandbox with certain test accounts, and then you say, okay, this is ready to go, and it just hits the real world of thousands and thousands of people and situations and edge cases and things like that, there can be things that we just didn't test for. So we're still ironing out a couple of those, but just trust that we're not quite finished, and we're not going to be finished until we're sure that everybody's account is the way that it should be. The one thing we do, because we've completed so many temping shifts, is we have statistical data. So we know that certain trends would show up as the top 10% of most reliable or the worst 10% of most reliable. So if somebody's completed 20 shifts and they have canceled a certain number of shifts, and we know, okay, well, based on the number of completed shifts and canceled shifts and when those shifts were canceled, because now we're scoring cancellations differently. If there was a long lead time, they're worth less of a cancellation. If it's kind of a last minute cancellation, it's worth more of a cancellation. But in the face of 1.3 million hours and all of those completed temping shifts, we know statistically where somebody probably falls in a band of needs support and some resources to help them become more reliable on our platform, or to get better feedback, or recognizing top performers who are really reliable and greatly skilled and get great feedback as sort of that pro and elite status and things like that. So we don't pick those out of the air. We do a real world statistical analysis and sort of look at how many shifts were completed, reliability, feedback, and that's where the subtlety of the old system wasn't working very well, because it was just too blunt and it wasn't baking into it the subtlety of the different bands and different trends and things like that. So the new system is going to work a lot better, and we're really excited about. We worked on it for about 18 months, just trying to figure out how can this be fair, how can it be diligent, how can we still manage our membership, because you can imagine as a dental hygienist or assistant, if you go into an office and the office is, let's say it was a bad experience for the office, we have to be mindful of that, because if the office says, well, I don't want to use TempStars anymore because of that, well, that affects everybody else who might have worked there in the future through temping shifts or getting hired that way. And similarly, the reason we care so much about dental offices providing great experiences is, you can imagine you're a highly skilled, reliable dental hygienist or assistant, and you go into a dental office and you have a bad experience there, and you say, I'm not going to use TempStars anymore because look at the offices they pair me with. Then that affects all of the other offices, because now other offices don't have access to great, reliable, skilled dental hygienists and assistants. So we really do care about, we really try to navigate and balance all of those different dynamics to make sure that we have skilled, reliable dental professionals on our platform and dental offices who care about providing a great work experience for people and who are reliable and not canceling shifts and paying on time and all of the other things that we care about. So, it's an interesting thing, and it's a really fun thing to navigate, and we don't always get it right, but those are the conversations we have about how can we solve those problems better. I don't have Instagram app and don't want it. Oh, any other ways to get connected? So this is, I think, so from the email we had sent out, we said I was going live on Instagram. And I think what we'll do is we'll reach out to Sonia personally and just say, because we're going to be posting this afterwards too, so anybody can watch it. So we'll send her a link for that. Would I be able to get jobs offers on TempStars if I'm in school and not certified yet? What areas can I apply for? Not quite. So the professional designation or qualification that's a bare minimum on TempStars for temping is level 1 dental assistant in Ontario. And so if you're not, if you're level 1 and not HARP certified, you could still use our platform, but it's really hard to find shifts because dental offices at least want somebody who's going to be able to take x-rays for them. Now, interestingly, we are, for dental assistants, we're going to soon be rolling out the role, like the scope of the shift. Because right now it just says dental assistant, and as a dental assistant you go in, you think you're working chairside, and you find out you're working steri center or floating or things like that. And so somebody could work the steri center if they were certified for IPAC or other infection control guidelines that way, but that's kind of where it is. If you're still in school, technically you could sign up as an admin, but you wouldn't have access to admin temping, but you could find a job as a receptionist on the platform through the job board system that way. I want to work in clinic and learn. I am planning HARP. I did my healthcare administration. Yeah, so a similar question. So internationally trained dentist. And I would encourage you, and we'll reach out because Shelby just did this incredibly great webinar with, I don't know, there was 240 internationally trained dentists, and it was just all about being set up for success in Canada and with our system and things to check for and things to do and that sort of thing. So yeah, we're big on and supporting anybody who wants to kind of have access to our platform and get into the profession. Don't have any experience, want to work in it. Yeah, the other thing we're doing is providing connections for charities. A lot of people, maybe new grads, they're asking, are there any volunteer opportunities or charity events or things like that? So we like to provide opportunities for people to discover those and engage with them. So whether that's just giving back to the community or trying to get some really experienced volunteering or and that sort of thing, kind of giving some considerations to that. I would like to work with orthodontists, I understand. I should start as a volunteer, but I don't know how I can apply. Oh, so that one's about volunteer too. So there could be volunteer opportunities. This one said, I'd like to work with an orthodontist, and that's a dental assistant. I understand should start as a volunteer. That one, so we have temping and we have getting hired. So the job board part, if you want a job with an orthodontist, then certainly you can look for orthodontic postings on our job board and apply for those as a dental assistant. From a temping standpoint, we don't really yet have a filter for dental assistants for ortho shifts. We have one for hygienists. So if you're an orthodontically trained and certified hygienist and can independently see patients, then orthodontists can post shifts for that, and a hygienist who wants to do ortho can do those. Similarly, we have that for restorative hygienists as well, but not necessarily for orthodontist for dental assisting, except for the job board. But I'll float that back to the team and see if there's any opportunities that we could build in there. I'm going to scroll up in the chat here, I think, a little bit, just to see if I've missed any questions or comments. Oh, good. All right, nice. This one, I want to ask that why TempStars only a portal of temping international graduate without the dental assistant course? There are no rules, only HARP certifications required. So again, this is a question, internationally trained dentist. So you're right, as a level 1 dental assistant, you could conceivably use TempStars as long as it was clear that you weren't HARP certified, which we have that. So it's possible to use the service. The reality is, and that's one of the reasons we introduced admin temping for dental assistants, is in most areas, the dental assisting shifts get a lot of offers. And so if we said, well, yeah, you can sign up as a level 1 assistant, just be really clearly, because in the sign up in the skills, it says I'm an internationally trained dentist, not HARP certified. Put that in there and you're on, and you can look at shifts and send in offers for shifts. The challenge is that with the number of offers that dental offices who post for dental assistants get, you might not get your offer accepted if it's clear that you're not HARP certified and you're level 1, because there probably are 5 or 6 offers of dental assistants who are level 1 who might be HARP certified. Now, the other thing we want to build in, and kind of that I alluded to, is that doesn't mean you can't, if you are IPAC certified or certified for infection control, and that sort of thing, or floating around but not taking x-rays but seeing patients. So there could be different scopes that you could do, but right now we just don't have that fine-grained posting and discovery mechanism. And so right now, if you were internationally trained dentist, level 1 assistant, not HARP certified, you can use our system, and it does allow you to sign up and view shifts that way, but the likelihood that you end up getting your offer accepted without HARP certification is just low. So you can use it, but it's just that's the challenge. As I would travel to, I would like all job offers to be in the city of Toronto, as I would travel to in the city of Toronto. Oh, that's interesting. So yeah, in the GTA, I mean, we have thousands of shifts in the GTA. So I'm not quite sure. Maybe this is downtown Toronto, because it just says City of Toronto, and this one doesn't have a first name. But yeah, in the sort of the downtown or the Toronto area. Now, specifically right downtown, I don't have that number off the top of my head, but I know that in and around the Toronto area, we're quite strong there. Dental hygienist. Now this one, it's an account question. It says keep anonymous, so whoever asked this one, we will reach out to you, but on my little question and answer thing, it doesn't have your first name or your email. So again, just touching on any of the account membership things, we're right in the middle of doing that full revamp, and anybody else who got caught on edge cases or things like that, we're going to make sure that everything is set right under the new Fair Fresh Start system. Yeah, so here's a question from Marcella, a dental hygienist just a question about in the United States. So we did expand to the United States, and we do operate in the U.S. We're in Arizona and Massachusetts and Illinois, technically in Nashville, but we haven't done a big push in in Nashville or Tennessee recently. So yeah, our vision is just to be kind of the best and most loved and first thought of and default way that dental professionals and dental offices connect for temping and hiring, and that's in North America. So we definitely have big plans and big vision. And as we roll out, of course, with us and our matches, it makes most sense that we target areas that have geographic density, because that's where you'll find the most offices and the most hygienists and assistants and make those connections sort of thing. So 100%, Ruben and Adriana on our marketing and growth team, we've got big plans for expansion and that sort of thing. Why can't we see the rating of those? Yeah, so this is a good one. Why can't we see the rating of the office? Both parties should have equal access. And that's something we're now that we've sort of pretty much got buttoned up this complete Fair Fresh Start membership management system for dental professionals rolled out, with a couple of fixes still to do and a couple of manual reviews of accounts that might have got caught in the interim and things like that. But as we're feeling good about that, we've shifted our focus to, so what do we do with dental offices now, and how do we ensure that there is a transparency there? Because I'll tell you my thinking about it. So when I think about somebody as a dental hygienist or dental assistant going in for a temping shift, and often it's somebody who wants and needs to support themselves and their family. And so there are offices, maybe the receptionist is mean. I mean, that happens, right? Or maybe it's an imperfect scenario. And then I think, well, if it's an imperfect scenario, that should be transparent, but I don't know if we should remove that office, because some people, if you need to pay rent and that's the shift that's available to you, maybe you would say, that's fine. As long as I know what I'm getting into, I'll go in and keep my head down and do good professional work and be a dental professional, even if I know that this is not an office that I might necessarily want to go to. I don't know. That's kind of how I think sometimes is, do we want to take a dental office completely off the board? Now we do and will take an office off the board for infection control violations and IPAC and things like that actually pose, workplace safety issues or risks to patients. Is if we get reports about those, we investigate those, and that office can't use our system until they have remedied the issues. And so we do feel strongly about that. But sometimes we get feedback, and you'll see when you complete a shift, it's like, how were their tools and how well did they set you up for things and things like that. And we want to know those trends, and we want to collect those data points. And similarly, then we have the statistical analysis to say, hey, yeah, your trending feedback is showing your tools are not so great. This can affect your ability to book great temps. It would be a great idea to get new equipment. So we want to be able to provide that feedback to offices so that they can be successful as well. So 100% that transparency we want built in. So we've kind of shifted our gaze to the dental office management side of things. So you'll be seeing changes coming in the next 2 to 4 months, I would say, as we start to just kind of debate what that should look like. And even you'll see if you're a dental hygienist or dental assistant in your account, then there's a My Stats page, right? So you can look at the My Stats and see how much you've earned and all of this different stuff. Dental offices don't have that yet. And so we do get requests from dental offices that say, how are we doing? Like, can you show us statistics, and are we well liked, and are we providing good experiences and those sorts of things? So we want to provide that transparency to dental office to help give them that feedback and insight to set them up for success. And also, as the question alludes to, provide the transparency so somebody can make an informed decision about where they're going into work for a temping shift. So I think that's just as important. How do I get started? So getting started on TempStars, yeah, tempstars.com. You just sign up, you pick your role if you're looking for work, or if you're a dental office owner or manager who needs people to work there for temping or hiring, go through, fill out your work experience, your skills and qualifications, and we do a review. Shelby's our onboarding specialist, so anybody who has any problems, she can help just guide you through, and she does video calls and things like that. She has a Calendly, so anything we can do to help people be successful. And we're also just, we're looking at just ways to improve the interface, to make it a little bit more cleaner and clear and intuitive and that sort of thing. So the idea being that for the most part it's self-service, but we're still there as a very friendly and responsive and human support team. So when we were at the Ontario Dental Association convention this spring, we had some people come up and say, I thought you were all bots. But it's funny that, no, we're a team of very enthusiastic and passionate people who want to solve these problems. The last question was, how do I get my offer accepted? So it says I have no luck. Now, there's a few different strategies, I guess. One of them is timing, when your offer goes in relative to when the shift is posted. Sometimes there, in your profile, make sure you've got your work experience filled out. There's also that About Me section, so make sure you've got a nice About Me written so that it's compelling and individual to you, because dental offices see and read those. Hourly rate matters, but interestingly, it is not a race to the bottom for the hourly rate. A good dental office wants a good dental professional in there, treating their patients, helping their practice grow, and providing a good day. And so it's not a race to the cheapest hourly rate. So I would hesitate to say your best strategy is pick the lowest hourly rate, because I don't think that's good for anybody. But there's some things that you could do to gain some work experience, or just make sure your profile is fully completed out and that you've got that nice About Me. Pick an hourly rate that is within range. And then as you start to gain a track record, that you're getting more and more shifts, then you're starting to build that profile, and then there's that ability to earn pro and elite status as you're completing more shifts and being reliable, keeping shift commitments and providing great experiences and getting good feedback, and then those shift bookings kind of accelerate that way. But as a dental assistant, and again, so we rolled out admin temping, and the way we rolled it out was, and the reason I didn't have it originally was, for my office, I would be hesitant to have somebody I didn't know come in and answer the phone and take money at the front desk and that sort of thing, because we really usually only had one person at the front. And so I was wrestling with that problem. And so our first version solution for that is, it's the admin temping shifts. Ironically, if you sign up as an admin, you can't, that's for the job board. If you sign up as a dental assistant and complete a certain number of shifts with reliability and feedback and establish that track record, we realize there's so many dental assistants who have been cross-trained on front desk and also want opportunities for more and more shifts. So if the shifts are competitive for dental assistants, what we've done is open up admin temping to dental assistants who are not, so you can't just sign up as a dental assistant, start booking admin. You have to build a bit of a track record, and then you get a little thing that says, you've just unlocked admin temping shifts, and here's what they're about, and do you accept, and do you want to see admin temping shifts? So you don't have to see them if you don't want to, but you can opt in to say, yeah, I've been cross-trained in admin, and I would love to pick up some admin temping shifts. So then you can do that, and then you can look at admin temping shifts, send in offers, and that sort of thing. So there's more opportunities that way. What else? Coming soon. I mean, we've got dentists. I couldn't believe this was the first year multiple people asked us about dentist temping. So we have wrestled with that, debated that. How do we make that happen in a way that is predictable and good quality matches for everybody and that sort of thing? So we have a solution for that, and relatively soon we will roll out temping for dentists, which will be interesting. Before this year, nobody asked about that. But at the ODA, multiple people came up, and some people messaged me directly, and we've had customer support questions coming in about, hey, what about dentist temping? And so that is something. It seems like sentiment has shifted, or maybe the demand for dental offices and the desire for dentists to have some flexible lifestyle in temping is something that we wanted to address. So we kind of listened to that, and we have it sort of spec'd out, and we'll think about when, timing-wise, when we'll roll that out, which will be kind of neat and interesting. That's it for questions. I'm going to scroll up again, and Anthony, I see your question here. So here we go. If I pick a shift and I do not get a confirmation and cancel within 30 to 45 minutes before the shift begins, does that affect me? So let me unpack that a little bit for the words. And maybe, write in the comment if I'm understanding it correctly. So when you say pick a shift, our normal mechanism is you're looking at shifts, and you look at a shift and you say, oh, I'd love to work that shift, and you send in an offer to the office to work that shift. And so at that point, picking a shift by sending in an offer, you can remove your offer anytime. There's no penalty for removing offers because it's not been accepted. And so if by pick a shift you mean you sent in an offer and then 30 to 45 minutes before the shift starts, you just remove your offer, no problem there. If you pick a shift and it's accepted, then it is accepted as a booked and confirmed shift. Now, canceling a booked and confirmed shift can have consequences. Now, we do have a grace period system, so if the shift is far enough in the future and you cancel it soon enough after it was booked, I think it's like 30, if the shift is 30 days out and your offer gets accepted and you cancel it within a certain amount of time, like quickly, then there's really no penalty for that, because the office has 30 more days to find somebody, and the shift's not tomorrow and things like that. But so I hope that answers the question. So if it's an offer, remove it anytime. If it's a booked and confirmed shift and you cancel it 30 to 45 minutes right before the shift start, that's going to cause some problems for the office. And so that does have, it affects your reliability trend and your reliability score and that sort of thing. It doesn't mean you immediately get completely kicked off the platform or not, because imagine real life happened and you completed 30 shifts and reliable and keeping shift commitments, but then life happens and just something came up that you needed to do that. Well, we don't completely ignore, nor does our system ignore the track record and trends that you've been setting and patterns of reliability. So it's weighted fairly that way too. I'm just gonna scroll. Why can't the shift be accepted the night before, at least 12 hours before the shift? So, Krista, why can't the shift be accepted the night before, or at least 12 hours before the shift? Yeah, we've been talking about that one too, because imagine if you sent in an offer on a Friday night, and then the office accepts it 6 in the morning for an 8 in the morning shift. And so we're trying to figure out the communications for that, because right now the best option is, if you know you have active offers that could be accepted for the next morning or in the short term, and you're not able to work one and you're not prepared to check it soon enough to be at that shift, it's better just to remove it. At least that's our first pass solution at that, and we're trying to figure out what do notifications look like. So imagine it's 7 o'clock on a Friday and you have 3 offers for 8 a.m. the next day. Well, we might send out a little alert, say, hey, heads up, you've got these offers that are active right now. The office could accept these at any time. If they're not something you're still interested in booking, please be sure to remove them. And sometimes we get offices accepting an offer 15 minutes before a shift, and there's no, that's just a real life situation that we would mitigate, and you wouldn't get penalized for canceling a shift if you just suddenly found out 15 minutes right before that this offer just got accepted and it's 80 kilometers away type of thing. So Those are just sort of the real life things that our customer support and membership management are there to help with. Let's see here. I'm just looking to see if there's anything else. If I pick up a shift and get confirmed, right? Nice. So, I'll stay on for a little bit longer just to mention some things. So we're pretty heavily involved in some charity events, and the Build Your Smile Foundation, there's a charity event in September that we're sponsoring, and there's also a nice lecture there too. So if you're interested in, it's a golf charity event. So we have a booth at one of the tee-offs, I think, and I'm giving a lecture with Mariella on AI and dentistry and that sort of thing. So nice event there if you're interested. They also do a Uganda trip, which I think this year is at the end of January. So if you're ever interested in kind of traveling to provide dental care, that's a really great foundation and organization to work with. Also shout out to Filling the Gap, which is in Scarborough, if anyone's in the GTA area. Amanda at Filling the Gap is just fantastic, and they're always looking for dentists, and I believe hygienists as well. So if you want to Google Filling the Gap, great people there. Little shout out to Deborah at Twice as Nice Uniforms. I'm wearing her scrub top. She's fantastic. She's based out of the US, so we've been working with her. We have a neat initiative coming out where we're having custom scrub tops made for some of our members who have reached milestones. So we have some dental hygienists and assistants who have completed over 500 shifts with us. So the idea of just a little tiny bag, and possibly, and I can't remember, I'd have to check with Mallory if we are doing embroidered name, but a little badge that says like a 500, and there's also a 250 and I think a 100. So we're going to be sending out some sort of milestones custom scrub tops for people, so that'll be fun, and that's with Deborah at Twice as Nice if you're looking for good comfortable uniforms. These are not paid advertisements, just people that we like to work with. Bianca Dorman and I, we're doing a talk coming up about just managing schedule and back to school scheduling and things like that. So we're going to be doing an online that, and that's in conjunction with ClearDent, because we have a partnership with ClearDent where the TempStars button is actually on ClearDent software now. So you can click on the ClearDent software, and then instead of going into the website, there's a button there that we're sort of integrated into there, and they've just been a fantastic company and organization to work with too. So we've been collaborating with them quite a bit. What else have we got coming up? We have a lot of new features coming up. Our roadmap and our engineering team, just in terms of accelerating how well we can get features out, there's a lot of interesting things coming out. So if you're a dental office, we've got plans for a subscription service. We also have a mentorship program that we're going to be rolling out, so that imagine if you're, a really an experienced dental hygienist or dental assistant and have this, amazing track record on our service with reliability and great feedback. And if you're interested in connecting with people who would love to be set up for success, then it's an opportunity to connect with people who might be new grads or who might be using our service but might be trending in the opposite direction, that we say, hey, here's a great idea. It looks like you might benefit from some resources or coaching about this. These are people who have indicated that they would be available for mentorship, so then there's a little connection mechanism in there for them. So that'll be coming this year. And our courses, so we're also going to be having a course listing system for continuing education in the app itself. And then the charity events too, because we get so much feedback about people asking about connections for charity events. So, not-for-profits will be able to either register events or register shifts and be able to, and so our dental professionals on our service, if they are looking for volunteer opportunities or charitable events or things like that, there'll be a nice way to access and see those. So, let me just see if I did the night before, right? If I pick a shift, got that one. I'd like to know why there's been a significantly decreased number of shifts lately. Now that's interesting. Simona, if you want to write in where you're from, because we daily track the number of shifts that are posted, and we've seen nothing but a dramatic increase, especially over summer and with our Summer of Smiles promotion. We're reaching all-time highs. So I don't know in a specific area, but I haven't our data and our analytics haven't shown what you're saying is a decreased number of shifts lately. So is it in it? So Ontario, we have about each person, wherever you are and your home address is, the area is 110 kilometers of where you see shifts from. So yeah, so in the GTA, yeah, that's interesting because, like I said, we have thousands of shifts in the GTA. So I don't know, they could be getting picked up quickly because we do have that promotion running on into Summer of Smile. So it's possible when shifts get posted and offers get put in that they end up getting booked quickly. But our data and our statistics and our booking board is showing just nothing but all-time highs in growth there. So it might just be a matter of checking back frequently and making sure that you're jumping on those shifts and sending in offers when you can. Is there any other questions? So I didn't really set a certain amount of time for this, and I know some people have just joined, and I hate to end it right when some people have just joined, but this will be posted for a review. And however, so Adriana is our digital marketer and social media manager, so whatever magic she uses to post things out, I guess it will be on Instagram. I'm not on social media personally myself very much, so I don't know all the mechanics of that, but maybe it'll be on YouTube, or maybe it'll be reposted on Instagram so everybody can watch it later. But either way, we're going to send out a communication to say, Ask Me Anything Live was great, and here's a link for it, and here's some highlights and things like that, and she might post little snippets and things like that. So if you happen to just join, I'm happy to answer any last minute questions, but yeah, I guess what I'll do is thank everyone for their time, and I do want to do these more often. I think the last one was maybe 2.5 years ago, and I wanted to do this one because we did roll out that new membership management system, and I wanted everybody to know that we listen closely, and all we do is try to fix things and solve problems and make things better. So we did hear all the pain points for the old membership management system, and as I mentioned, it worked well to a certain scale, but at a certain scale, it just started to not work because it wasn't capturing nuance and subtlety. It was just too blunt of an instrument, and it was sidelining people unfairly and too trigger happy on some things and that sort of thing. So 18 months of conversations and work to get to this new Fair Fresh Start system we just rolled out July 2nd. And for anybody who just joined, July 2nd it got rolled out. It needed a couple of quick fixes once we rolled it out, so that release went out a couple of days ago. A couple of other niggling little issues we're going to fix in the next week or so. And at the same time, some people's account just on edge cases need a manual review. So we're not going to let anybody slip through the cracks. So if anybody on the call has questions or about their account or being blocked or not seeing shifts or things like that, our support team's aware. So don't hesitate to reach out because they know we just rolled this out too, and there's solutions and pathways that we're going to be able to find for people. So yeah. Well, thank you everyone. And appreciate your time, and it's been nice interacting with you and chatting with you, and I'll see you on the next one. Take care. And now I have to figure out how to close live. I think it's this X.